And I'm talking directly to the audience here because women need to understand that your estrogen and progesterone levels will dictate whether you go through perimenopause or not. Hello, everyone. You're listening to the MeNoPause Moxie Podcast, where we strategically challenge the status quo on perimenopause, menopause, and female hormone balancing. I'm Marie Hoäg, and I'm here with my producer and co-host, Maggie Kuhn. Perimenopause has been sold as an unavoidable transitional decline, but that's an industry lie. In this episode, you'll learn why perimenopause and menopause are not inevitable. In this episode, I'll reveal the science and the clinical evidence behind estrogen restoration and why addressing deficiency early can halt the decline before perimenopause accelerates into menopause. Hello, Maggie. Nice to have you here with me.
Hey, Marie, great to be here. Wow, that is a strong statement to say that this is an industry lie. I'd like to hear more about why you're saying that. What is this about?
The industry lie is that perimenopause and menopause are unavoidable. And I say this because I've seen it with my own eyes. When you restore the missing hormones that regulate a menstrual cycle with thousands of women who are able to do that with HRT, then you have a pretty good idea that perimenopause doesn't exist. And I did that with myself. I restored my hormones that reversed my perimenopause and my menopause. But also, there's a lot of missing data. There's data that's been removed out of the National Library of Medicine that talks about these things. And so it really makes me question if perimenopause and menopause are really necessary. But you also have to look at, Maggie, that there is a lot of money to be made off of women suffering. There's not a lot of money to be made restoring hormones and keeping women from experiencing perimenopause. And there's a lot of money to be made from women in menopause. So I think if women understood that they can avoid, prevent perimenopause and menopause just by taking action, that they'll see for themselves that this is a lie.
Well, we promised on this podcast that we were going to challenge the status quo. And I would say this is the biggest challenge that you bring to the status quo, which is perimenopause and menopause are avoidable. So if the industry standard is to say that it's not avoidable, that it's inevitable, how would you suggest that we look at perimenopause?
Well, if you look at perimenopause as the hormone deficiency condition that it is, then it can really be addressed. And so perimenopause is really a side effect of hypoestrogenism. And hypoestrogenism is really estrogen deficiency. When estrogen is deficient, this influences the production of all the other hormones, including progesterone. And estrogen and progesterone are needed to restore and maintain a healthy menstrual cycle in women. So when estrogen is low, then all the other hormones will also be low. And so hypoestrogenism happens when the ovaries are unable to produce healthy levels of estrogen and progesterone. And this can really happen due to, well, one, unhealthy ovaries, but also the signaling to the ovaries to produce estrogen and progesterone. So if you look at the condition itself, well, hypoestrogenism, and that's secondary to female hypogonadism, meaning that there's a problem with the production of the ovaries that keep women from getting enough of their main sex hormones to regulate a healthy menstrual cycle.
Why is a healthy menstrual cycle important?
Well, I tell you, the menstrual cycle is probably a beacon of health for a woman, mental health and physical health. It's one of the most outwardly ways a woman can tell if her brain and body are functioning correctly. If the menstrual cycle is dysfunctional, then a woman will experience mental illnesses and physical deterioration and decline. And there's actually quite a bit of data on this using menstrual cycles as the fifth vital sign. And we talk about this more deeply in another podcast But women really want to look at their menstrual cycle as a vital sign. If the menstrual cycle is dysfunctional, then chances are a woman isn't producing enough estrogen and progesterone to regulate this menstrual cycle, and they need to find out why. So it's really a clue for a woman of any age, the menstrual cycle, to determine whether she's producing enough of her female hormones or not. There's really never a time ever that a patient doesn't come in with an unhealthy menstrual cycle that she isn't riddled with mental illness diagnoses.
Wow, you're really tying a lot of disparate things together, which I think our listeners are probably also connecting the dots for themselves and maybe others that they know, that some of the things that have been happening in their life health-wise may be related to this. What else can cause hypoestrogenism?
Well, anything that will cause an underproduction of estrogen, and it can be many things. A lot of women don't realize it. They cause a lot of their estrogen deficiency issues. One of those things is the transgenerational inheritance of broken ovaries. So your mother can pass down her broken ovaries to you, and then the stress and dietary and lifestyle of the mother will further break down those ovaries and then pass that on to the next generation. So, as you've heard me mention before, when I talk about the transgenerational inheritance of ovarian dysfunction, that our ovaries over the generations have been broken and compounded with dysfunction at every generation. This is why we see these younger women not able to manage a healthy menstrual cycle from the get-go, because their ovaries are just not healthy enough from the beginning. And also endocrine disrupting chemicals, the chemicals that we put on our body, that we inhale, that we consume, that we absorb through our skin, that'll shut down ovarian production. Medications, vaccines, the COVID vaccine, actually, we saw this quite clearly. A high processed food diet acts as an endocrine disrupting chemical and can shut down the ovaries. Gut dysbiosis, having stage 2, 3, 4 gut dysbiosis will shut down the ovaries. Circadian rhythm disruption, sleeping during the day and being awake at night, this will shut down the ovaries and underproduce hormones. A high stress load, high stress environment, whether it's at home or work, it could be environmental. If women are walking on eggshells at home because they fear their environment or work, this stress, this increase in cortisol can shut down the ovaries. Surgeries, it's quite common where we can get hormones balanced for women and they have to go in for a surgery and they come out of surgery and we have to rebalance. So having surgery, the stress of surgeries and being on antibiotics can lower estrogen levels. And other medical conditions like Turner syndrome, and other types of medical conditions that will keep the ovaries from functioning the way that they should. And aging follicles. When our follicles age out and we lose all of our eggs, then our brain is like, well, we're not in our reproductive prime anymore. We can't have children. So if there's no reason for the ovaries to produce estrogen and progesterone because there are no eggs, well, then the ovaries will shrivel up like raisins, and then the hormones will decline, and then that causes a disruption and a collapsing of the menstrual cycle. So there's several things that can cause a woman to become hyperestrogenic. But estrogen deficiency is not a woman's friend. And this is the thing that I want women to really pay attention to is estrogen really does dictate absolutely everything in the female body from head to toe. There isn't one function in the female body that estrogen does not influence. And when estrogen and progesterone are so low that you can't maintain a healthy menstrual cycle, no matter how old you are, then you will feel cruddy. And I'm talking directly to the audience here because women need to understand that your estrogen and progesterone levels will dictate whether you go through perimenopause or not. The most important thing that you can get out of this is to understand that it's your estrogen and progesterone that dictate your menstrual cycle. And estrogen is responsible for the production of all other hormones in the body. When a woman is estrogen deficient, or when you're estrogen deficient, then you will not be able to produce healthy levels of progesterone to maintain this menstrual cycle or any other hormone in the body. So the brain and body will deteriorate, and you will see it with your menstrual cycle. So if your menstrual cycle is not working right, if your periods are too long, too short, heavy, painful, non-existent, then there's an extremely good chance that you're estrogen deficient. But let's take a closer look at perimenopause to understand how it can be prevented and reversed. So we want to look at perimenopause in 3 stages because it is a staged process. There's 3 stages of perimenopause. So here I've added a chart here to take a look at, and this chart lays out perimenopause nicely. It is the chart of the 10 stages of reproductive aging for women. And if you look here, I've highlighted that perimenopause is in the 3 stages, and it's marked by stage 1 here of perimenopause is -2 on the chart. Stage 2 perimenopause is -1 on this chart. And stage 3 perimenopause is +1A on this chart. Now, stage 1 perimenopause is marked by declining estrogen levels. Well, estrogen begins to decline before stage -2. I'll refer to the stages on the chart so it's clear. So stage 1 is early perimenopause. And this typically happens to women. A lot of women say, oh, well, perimenopause starts 10 years before menopause, but that's just really isn't true. We see women in stage 1 perimenopause here in their early 30s, mostly. Early to mid 30s is when this happens. And this is when estrogen is already in the decline at this stage, when women will see beyond the changes in their menstrual cycle, but they'll see irregular periods greater than 7 days difference. Also during this time, FSH begins to rise, and FSH is the most important lab a woman can take. And just a thumbnail on FSH, FSH is the barometer in a woman's brain that tells a woman whether her brain and body needs estrogen or not. So when FSH begins to rise, this barometer is signaling, hey, I'm needing some estrogen here. My estrogen is so low now that it's triggering the thermostat to tell me that I need some estrogen. So stage 2, which is stage -1 on this chart here, women can experience somewhere in their mid to late 30s, where estrogen is in a deficient stage. We know this because FSH is greater than 25. And this is really where women will feel some true mental illness issues, severe anxiety, severe depression, headaches, mood swings, irritability, anger outbursts, detachment, emotional detachment. This is where a woman is considered estrogen deficient, and her missed period interval is greater than 60 days. Stage 3 is late perimenopause. It's +1 on this chart. Women will experience this in the early 40s. And this is really where the industry says that this is where perimenopause starts. No, perimenopause started even long before stage 1. It's almost like a stage -1 when the periods are irregular, but it's such an ambiguous time that really stage -2 on the chart is where we really want to address perimenopause. But in late perimenopause, this is where women are no longer having a period. And this is that time period where women are not having a period and they're counting the days because they know that it's been so long. Like they go 3 months, 4 months, 5 months, and like, oh, I guess I'm in perimenopause. In a year of not having a period, I'll be in menopause. And that is really what the gold standard we use to define menopause is not having a menstrual cycle for 12 consecutive months. So if we address perimenopause as the hypoestrogenic disorder that it is, then we can do something about it.
Okay, so what is it that women can do? How do women go about reversing their perimenopause?
Well, you can see on the chart that as each stage of perimenopause passes, that estrogen gets lower and lower and lower. So as I mentioned, the message here is estrogen dictates whether a woman experiences perimenopause or not. And so the goal is to fully restore these missing hormones, estrogen, progesterone, and any other depleted hormones, but mostly estrogen and progesterone, the two hormones that are responsible for the menstrual cycle. The goal is to fully restore those depleted hormones to what we refer to as the hormone sweet spot, and to maintain those levels so the brain is always under the impression that a woman is in her reproductive prime. Because remember, hormones are messengers. They are signals to the brain that tells the brain to tell the body what to do, how to perform, how to behave, how to function, how to age, and how a woman feels, how she thinks, what she says, how she responds. So when hormones are deficient or they're declining, then these messages are telling the brain, well, you're old. And we don't want our hormones, our declining hormones, to tell our brain that we're old. We want our hormones to tell our brain that we're in our reproductive prime. So when you restore hormones to the hormone sweet spot, that tells the body, the brain, that a woman is in a reproductive prime. Now, a lot of women really freak out about this. But when a woman's hormone messaging is that she's in her reproductive prime, but her physical body does not match that, then what happens is the physical body wants to get as healthy as possible to mimic a woman in her reproductive prime. So this is where the healing and the repairing comes in. One of the first things that happens is, well, guess what? The menstrual cycle comes back, and it comes back in a healthy way. And when this happens, all the processes of the body also restore and heal and repair, like the digestive system, the circadian rhythm, the sleep cycle, and all the other processes in the body that are dependent upon the menstrual cycle to function. So it's really important to restore these hormones that tells the brain that you're in your reproductive prime instead of you're an old lady.
And I would think, Marie, that what you're getting at with this protocol and with this approach is not necessarily to be forever young, to be forever 30, or to be able to have a baby into our 60s or 70s. What we're talking about here is health span to match lifespan. We're all living a lot longer, 70, 80, 90, 100. I know women whose mothers are living to 105, 110. So we don't want to have 60, 70, 80 years of misery. And what you're saying is that we don't need to. Yes, estrogen does naturally decline, but we don't have to let it become disease. We don't need to let it turn into mental health issues, sleep disruption,
No.
all the things that come. Now, it's not to say you will never age. It's to say that you will have better health. Am I correct in understanding that?
You bet. It improves the quality of a woman's life, mostly because of how it influences a woman's brain. Estrogen, if you can maintain estrogen levels in a reproductive prime stage, then the brain wants to function as healthily as possible. And the executive function comes back and it restores. I think once women realize how powerful estrogen is on the brain and the signaling of the body to function and to be healthy, it'll be a game changer. And that's why we're doing this, is because we don't believe that perimenopause or this decline is inevitable. Yes, the hormones will decline, but women have more control over this and the hormone messaging than we've been led to believe. So we want to improve the quality of a woman's life, but not just the quality of her life, but her health. Because if the brain and body are not breaking down and falling apart, then women can live a wonderful life with her wits about her, with minimal to no mental illness diagnoses. And that was the big selling point for me. As long as I maintain my estrogen in my reproductive prime, I do not have mental illness. When my estrogen gets low, the more mental illness diagnoses I get and the more severe it gets as my estrogen declines. And this is why I get really irritated when I'm doing my research. It's like, where are the studies that talk about this? We're only talking about low dose HRT here, which there's some really good studies on low dose HRT, but we need better research on adequate dose and therapeutic dose HRT protocols and what it does to the brain and body of a woman. We need those studies that say, oh, when you maintain estrogen in this range and progesterone in this range, you can actually restore a healthy menstrual cycle. And it's not having babies that it's the thing. Having a menstrual cycle is more of the side effect, a non-incidental side effect to having fully restored hormones, and all the benefits that women get from having a fully restored hormone tank is just astronomical. The energy, the libido, the body, the brain, the sense of feeling alive. I get really passionate about this because it's been such a life-changing thing for not only me, but the thousands of women I've worked with over the years who've experienced this for themselves.
Absolutely. Marie, how long can a woman prevent perimenopause?
Well, the short answer is indefinitely. As long as a woman chooses, it's a woman's choice. A woman has a right to choose how long she avoids menopause or if she experiences it at all. Like, I will never experience menopause in my lifetime because that's my choice. But I want to be given that choice. I don't want somebody else to tell me how much estrogen I get to have. And this is my concern, as I mention it all the time, especially on social media. I don't want the Menopause Society telling me that I only get 1 milligram or 2 milligrams a week of estrogen. I want enough estrogen so that my brain is under the impression that I am young and healthy. And being 61 and maintaining a regular cycle for me is just, it's so empowering. And I know that when my estrogen declines, if I made a mistake in taking my hormones, I can tell when I don't have enough estrogen. And this is what I want women to know. You'll know if you don't have enough estrogen. Listen to your body. If you have headaches, mood swings, you're irritable, you're not yourself, if you're not happy, your estrogen is low. And it's very, very difficult to be unhappy when you have plenty of estrogen, even when things are going south. Estrogen truly is the happiness hormones. And so the goal is to, if you look at the chart that I have up here, if you maintain estrogen in your reproductive prime in -4, -3B, then your brain is under the impression that you're young and healthy. So the body rebuilds itself and wants to restore a healthy menstrual cycle. You will not be able to grow new eggs. You will not be able to get pregnant once you've lost all of your eggs, but your brain and body will be under the impression that you should, and therefore the body will want to be as healthy as possible. It will restore, rebuild, and rejuvenate your cells, your tissues, and your organs to perform at an echelon level.
So, when is the best time for a woman to begin advanced HRT?
In stage 1, perimenopause, or even before that, as soon as a woman realizes, well, two things that I tell patients. When you're in stage 1, when your periods are longer than 7 days, or if you're starting your period early, that's a sign that your estrogen is deficient enough that you need to pay attention, because those hormones need to be restored, or you will continue to go into a decline. The other factor is when a woman has made the decision that she's no longer going to have any more children. The childbearing is over and the menstrual cycle is irregular. That's when that is the prime time for a woman to start hormone therapy. Don't wait until your hormone tank is completely empty.
Well, that's, unfortunately, that is common practice right now. And this is part of what we are trying to educate women about with this podcast, is that it doesn't have to be this way. And this is definitely challenging some deeply ingrained societal beliefs about what's inevitable with aging, what we must endure, what we must suffer through, and the
But
quality of life we don't deserve.
I don't think women realize how much of their lives are spent hormonally deficient. My next chart here that I have up shows you just how much time in a woman's life she's estrogen deficient. For the most part, most women spend the majority of their lives hormonally deficient. And really, the best way to restore these hormones is you have to go to somebody who knows what they're doing. If you go to a hormone specialist or a menopause expert or a hormone balancing expert or people that talk about hormone balancing, you really have to vet them carefully because they have to be trained in full hormone restoration. Going to somebody who's going to slap a patch on you is not going to do the work. They will not get your estrogen and progesterone levels where they should be to maintain and restore a healthy menstrual cycle. So going to someone who is trained on the technique and the process of full restoration is super critical. Also, you need to get on an advanced HRT system, a therapeutic dose rhythmic protocol, meaning that the dose of those hormones mimic a woman in her reproductive prime, a therapeutic dose, and those hormones are administered in a way that cycles the progesterone to allow for a healthy menstrual bleed. So there is a technique and a process to fully restore those hormones so that a woman can get into a reproductive prime and maintain that there as long as she chooses. Some women have been on this protocol for 20, 30 years and swear they'll never be off of it.
Yeah, well, that's another myth that you hit a certain age and you have to go off of all HRT.
Oh no, that's another lie. Oh yeah, you're 60, get off the hormones. Are you kidding me? There's some women who have never been on the hormones and are at 60 going, but can I take them now? Yes. There is never a time in a woman's life ever that she feels good without estrogen. Even an 80-year-old woman would benefit from even a low dose estrogen. We won't be able to fully restore her menstrual cycle at 80. But if you start young, you can maintain that cycle for life.
Well, Marie, I think this has probably been very eye-opening for our listeners today. If someone wants more information on how to reverse perimenopause and all the things you're talking about today, where do they go?
I'll tell you something. If you're a high-performing woman or trying to manage a household, or you're just trying to cope and you know your hormones are out of balance, even if you are on HRT, if it feels like your hormones are out of balance and you're on HRT, then your hormones are not balanced. Chances are you're on a low dose hormone. I recommend booking a complimentary consultation at advancedhormonebalancing.com. I launched an online telehealth hormone clinic that allows women access to these doctors that are trained on therapeutic dose protocols to restore a healthy menstrual cycle for as long as a woman chooses. So I wouldn't wait for a moment. There is a new day. And let me tell you something, the future of menopause medicine will change, and we are really on the cutting edge with this. So advancedhormonebalancing.com and book a complimentary consultation. We can see if one of our advanced hormone balancing programs are a good fit for you. That's the only way you're really going to know. Because really, this advanced type of HRT protocol is not for everybody. It's good for most generally healthy women. If you really want to get your hormones balanced to the sweet spot and keep them balanced for life, then this is the best way to go. Also, we really appreciate you joining this podcast. There's a lot of podcasts out there that you can be listening to. And if there's something that you would like us to consider discussing on this podcast, go to menopausemoxie.com/podcast and go to the contact form there and let us know what you think and what you want us to cover. And we'll be happy to do that. Or if you want us to expand on something that we've covered, like something like in this show. I know this was just a little thumbnail sketch on menopause and perimenopause prevention, but it is huge and it is the future of menopause medicine.
Well, Marie, thank you so much for sharing your expertise and this fascinating conversation about perimenopause prevention. And I want to thank all of our listeners and viewers for joining us today as well.
Yes, thanks a bunch, Maggie, for being here with me and all of you that are listening. We'll see you guys next time.